more and more research keeps coming out as to the relationship between the health of our gums and the health of our brain. And we're going to talk a little bit about how that works, what we can do about it, and some signs for caregivers and ourselves to look out for.
Welcome to the Semidey Dental Podcast. We're here to provide you expert insights on how dentistry can improve your quality of life and extend your health span. I'm Alex Semidey, and I'm a practicing dentist, and I'll be your host, along with Jeremy Wolf. Enjoy the show.
Welcome back, Tooth Tribe, to a new episode of the Semidey Dental Podcast. Mr. Wolf, how you doing today?
Living La Vida Loca. Last time I was living the dream. Now I'm living La Vida Loca. So
living La Vida Loca.
Always doing well, my friend. Always.
Ricky Martin in the 90s. Nothing better than that. Yeah, so today we have a very important podcast. A topic that really hits very near and dear to my heart, and that is dementia and generally cognitive decline. And specifically today, we want to talk a little bit about how your mouth actually plays a pretty significant role in that process. More and more research keeps coming out as to the relationship between the health of our gums and the health of our brain. And we're going to talk a little bit about how that works, what we can do about it, and some signs for caregivers and ourselves to look out for, to, if not altogether avoid cognitive decline, at least minimize it to improve our quality of life, really.
Yeah. Speaking of caregivers, I just did earlier this week a podcast with Comfort Keepers. They do in-home care. And we talked about this very issue. We talked about dementia and Alzheimer's and how that relates to the caregiver side of things. And this also hits hard for me as well, because I've had family members. My grandmother suffered from Alzheimer's, and I watched her go through a horrible cognitive decline. And if I'm being honest, I never even thought about the connection to your oral health and your mental clarity. And I know that's a big thing for you. So definitely interested to get into this. Why don't you start off by distinguishing between dementia and Alzheimer's, and then we'll go from there.
Sure. Yeah. So dementia is kind of like an umbrella term for cognitive decline, right? And cognitive decline, we've all seen it, right? It's a little bit of memory loss. So maybe you have a loved one who kind of repeats the same story a few times, or forgets where they put their keys, or that sort of thing. And we generally just chalk it up, oh, they're a little bit older, maybe they've just got a lot going on, but that is generally what it means. And obviously that progresses and progresses to the point where it becomes very difficult for the patient and the people around them. And then Alzheimer's is a specific diagnosis, right? It's the most common type of dementia. So it's the one that we hear about the most. It affects 6 million Americans, right? Which is a really sobering number. It really is. And the kind of the key hallmarks of Alzheimer's that we hear a lot about are these plaques in the brain, these protein tangles, and ultimately like brain cell death and lack of function. So that's what leads to the memory loss and ultimately loss of independence.
So obviously age and genetics play a huge component in this, as well as your lifestyle and how you take care of yourself. But what about oral health, like inflammation and oral health? How is this playing into the propensity for the body or the mind to get afflicted by these terrible ailments?
Yeah. For a very long time, we had an idea of how the whole cognitive decline thing worked, but we still don't have a full grasp on it. We're elucidating the process and figuring things out. And what we're learning is that inflammation plays a huge role in the whole process. And with the mouth specifically, the bacteria that we have in the mouth is a very unusual location of the body, right? Like it's inside us, but it communicates a lot with the outside world. And what happens in the mouth it's like the opposite of Vegas, right? What happens in the mouth does not stay there. So you have, and I've said this on the show before, the bacterial concentration in your mouth is equal to the bacterial concentration in your colon. So that sink in for a second, right? It means you have a tremendous amount of germs and bacteria in your mouth. Now, it is because of our modern diets super important to be on top of that, of the maintenance that the mouth requires, right? Because our modern diets are basically designed to help bacteria proliferate. So we need to be very diligent with our brushing, our flossing, our water picking, our at-home care to minimize the amount of bacteria that we have in the mouth. Why? Very easy. Because if you have a lot of bacteria in the mouth, that leads to inflammation, right? A lot of bacteria is literally a low-grade chronic infection of an area. So that leads to inflammation. That's where we start seeing gums get a little puffy, a little red, right? Maybe you brush or floss and you see a little bit of pink in the sink, right? A little bit of bleeding, and you don't really make a big deal out of it. But what's happening when you see a little bit of blood, right? That means that some little blood vessel somewhere burst open and is letting blood out. Now, if blood can get out, that bacteria sludge that is happening there can get into your bloodstream. And now it has free access to the highway throughout your body. So we're finding some of these, specifically a bacteria called P. gingivalis. Gingivalis means gingiva, which literally means gum tissue. We're finding that bacteria in Alzheimer's patients' brains. So that just goes to show that it is going in through the gums because the gums aren't healthy. We have a little bit of bleeding, bacteria gets in, it travels around. It literally goes to every single nook and cranny in your body. And we keep learning more and more about how that gum inflammation has profound impacts in every corner of the body, including the brain.
Fascinating stuff. Speaking of the science of it, clearly there's a lot of studies and work being done in this field. What are some of the new things that are coming out now? That, because I got to imagine that as AI just keeps getting more powerful and technology keeps increasing, we're going to have more solutions and more ways to deal with this stuff in the future.
Yeah. What is AI going to do in the next 2, 5, 10, 20 years? Who knows, right? But the amount of things that we see in the very near future are really powerful screening tools that are AI driven. So things like using a saliva sample, literally spit in a little cup, and we'll be able to run all sorts of tests on that saliva and see things that could be markers of early dementia, of early cognitive decline. And as the science progresses, we'll be able to figure out more and better ways of helping our brain withstand that assault and stay healthier and functional longer.
Yeah, it makes so much sense on its face, right? Eat healthy, take care of yourself, exercise, right?
Yeah.
Do all the things that are going to optimize the machine, which is our body. Yet we've talked about this so many times with everything we do, right? Life happens, right? Things come up and it becomes difficult to maintain this stuff. One of the things I found interesting regarding diet, as I get older, I'm just more aware of this stuff. And I was thinking to myself, like, how important it is what we're putting in our body, the fuel. And I went on chat and I said, hey, is there an app out there? And I'm sure there is, where you can do all lab tests and it will analyze everything and then give you like a specific detailed breakdown of a diet it's customized for not just your age, your weight and all that kind of stuff, but actually your specific biomarkers. And that stuff exists. And there's companies out there doing that now. And I can see a future where obviously we don't want to get too stuck to that. We still want to live our lives and we still want to have fun and do things. But if you want to live a long, productive life and a prosperous life and avoid these types of ailments, you have to start thinking about this stuff. And so important to have these conversations just to raise awareness, just to get people starting to think about it.
100%. And when it comes, I don't know about you, man, but when it comes to dementia and the whole cognitive decline thing, it just terrifies me. It terrifies me.
Yeah,
and it is a definite point of focus for me in my life to do things that just improve my odds. Like, you can't bulletproof yourself against it. There's all sorts of factors, like we were talking about. Genetics is a factor, lifestyle is a factor, environment is a factor. But doing things like you were mentioning, working out, eating a balanced diet, staying healthy, but beyond working out your body, work out your mind.
Yep.
Continue learning, putting yourself in uncomfortable situations.
Let me add a caveat to that. Sorry to cut you off, but doing uncomfortable things, but doing it intentionally.
Yes.
Not suffering involuntarily, right? Because you've been hijacked, right? Doing
Sure.
it matters, dude.
Yes.
Like if you need to learn a new task, and this like links directly into dementia and everything. Like, how many times do you lean into that and you get overwhelmed, right? Your body throws up brain fog and you get clouded and you get frustrated and you're like, I can't do this right now. And you have to step away from it. If you just go into that process with a totally different lens by looking at, okay, that uncomfortability, that is the growth. That's what's happening. Your brain is rewiring itself in new and interesting ways that are trying to get you past that. And if you just look at that, this is part of the process. Like, I'm in it. This is fantastic. Just framing it like that in your mind, all these different chemicals in your body.
It's called cognitive load.
Yeah.
And it's important. And actually, let's talk a little bit about that, because I just read a study recently where we're tracking a bunch of college students. And they broke them up into groups and they gave them a task. And some of the kids had to go about it the old school way, right? Go to the bookstore, get a book, or read the book and do a paper. Some kids got to use Google. Some kids got to use an LLM chat or whatever. And they were literally measuring how much their brains were working. And no surprise, the more we start using chat to offload our tasks, the less our brains are working, y'all.
The more the light goes out internally.
Yeah.
You're like outsourcing the intelligence to, you're like dumbing yourself down.
Yes. Yeah. So it is super important for us to be very intentional about working out our minds, right? And this isn't when we're retired and we're 65 and dementia is already like not knocking at the door into your living room, right? But when we're young, when we're in our 30s, 40s, 50s, right? Let's set ourselves up now to enjoy our 60s, 70s, and 80s, right? Not be a burden to ourselves and to our loved ones.
Oh, yes. I feel like I'm having a short bit of dementia here. Speaking of the scary aspect of this, just when and this has all happened to us, right? You go to the fridge to get something and you open up the refrigerator and you forgot what you were there for. That just happens. Those are just like, I consider them brain farts, if you will. But like the other day I was driving home and I forgot where I was for a minute, brother. Like I don't know. I don't know if it was a one-off. I was like on a road that I've driven down thousands of times and I got panicked for a minute. I'm like, holy shit. And I thought about, this must be what it's like when you get older and you start getting dementia. And if that becomes something that happens frequently, the solace I can imagine in that is that at some point you stop trying to find it, you stop searching, and you're just here. You're just like, whatever. You know what I'm saying? You're not trying to chase it all the time, but it is frightening, man. It really is.
Absolutely. And it's really easy to chalk a lot of those instances up to, shoot, I just have a million balls in the air, right? Obviously, your brain can't multitask all the time, and you're going to have a brain fart here and there, right? And just open up the fridge. Why the hell am I here again? I think it's really important to not bury our head in the sand for what those instances might be telling us, and to be very vigilant for things, not only with ourselves, but with our loved ones. And furthermore, to take those preventive action steps, right, as frequently and early as possible, so that, again, we can't bulletproof ourselves, but we can improve our odds, which is what we're trying to do.
Yeah. It never ceases to amaze me how fickle the mind could be when it comes to this type of stuff. Like, sometimes forgetting things is a blessing in disguise. I remember a year ago, 2 years ago, I was sitting down and I was preoccupied. I think I've shared this story on the podcast before, at least with you. I was worried about something and it was like impending doom overwhelming me. And, oh my God, I got to do this. And I was just frozen. with like fear of this thing that I had to do. And for a moment, I forgot what it was that I was worried about. It totally escaped me. And then I got panicked for a minute. Oh my God, I forgot the thing. And I realized how absurd it was. I was obsessing over a silly thought that came up of a thing that hadn't even happened yet, that it maybe had to do, maybe I wouldn't do it. Then I forgot it. Then I got up and I realized it's like meditation is so huge when it comes to this stuff, right? Coming back to present, learning how to, when emotions do flare up and you get overwhelmed by things, learning how to not ignore them, but acknowledge them and then just get yourself back to present. And I think that's really powerful practice. Obviously, exercise, diet, all this stuff we're talking about, learning new things, but then also being still, being present, unplugging yourself, right? Getting away from these damn devices that we're on all the time and just
Sure. There's just so much noise around us, right? That it's sometimes hard to process it and continually process it just all the time. That's a really interesting point that you're making here. And I thank you for giving me another rabbit hole to go down. But the potential impact of meditation on cognitive decline. Because I do think it is a very powerful and beneficial habit to just try and quiet the mind and have a moment of peace, right? But how does that compare and stack with cognitive decline? Would it help us? Would it exacerbate it? Would it help prevent it? Would it slow it down? I wonder how much research has been done on that, but I will look into it and I'll bring an update on the next show.
I'm sure there's been plenty of research done on it. And it's like all these tools, they all work incredibly well together, right? It's not just don't do one thing, do a lot of different things, right? And create habits and create routines. Actually, I don't like the word routine. Somebody referred to it the other day as rhythms instead of routines. I think routines has the tendency to feel like, I don't know, just who wants routine?
Trivial.
But I want to get in a rhythm. Who doesn't want to be in a rhythm? Who doesn't want to be on rhythm?
And that, folks, is the power of marketing and copyright.
Oh, goodness. So where are we here? We've gone down a rabbit hole. Let's pull this back here. Where are we at, Doc?
It's very fitting that this is the dementia episode.
You gotta go with, yeah. So lost my train of thought. Goodness gracious.
So let's talk about a few of the key points things that we can do. Obviously, the central theme of today's podcast is how your gum health will relate to the whole cognitive decline process. It has to do with inflammation. It has to do with our diet. It has to do with the bacteria in our gums. So if there's one key takeaway from today's episode, I want it to be that if you see some bleeding in the sink, don't disregard it. If you're not really concerned about the health of your gums, think about the health of your brain, right? Because those two things are intimately linked, right? And when we intervene early in the process of gum inflammation or gum disease, it is very predictable, very easy to cure, and we can completely reverse that trend and get you healthy and in maintenance mode. And like I always say, high five on the way out every 6 months when you come in for your cleaning. The problem happens as that early gum disease, or gingivitis, as it's called, progresses and becomes periodontal disease. Now this becomes a chronic infection that is not curable, right? It's manageable, but you are dealing with this infectious burden in your gums for the rest of your life. So early detection, early treatment when it comes to the health of your gums is super important. I really can't overstate that. So things like bleeding gums, bad breath that you can't quite pinpoint, doesn't go away, any redness or swelling, go get checked out, right? Visit your dentist and see what's going on. Get on top of it early. As far as caregivers go, this is a point that I want to make before we wrap up the show. It becomes very difficult for caregivers when patients start to go down that slope of cognitive decline, because all of those routines or rhythms become a lot more difficult, right? As our memory loss starts to progress, we have like physical limitations and dexterity issues. So what happens is like the early stages, okay, like the gums are suffering a little bit. Now the patient isn't able to keep their mouths clean as well. So the gum inflammation and gum disease process progresses. Now it becomes worse. It starts affecting the cognitive decline, right? And it works both ways. So it just snowballs, right?
Yeah.
And it's super important to equip these folks with the tools that they need to help, right? Whether that be an electric toothbrush, whether that be a toothbrush with a bigger handle that they're better able to manipulate and get their mouths clean, getting them water irrigation like a water pick. They sell toothbrushes now that are ultrasonic with a water pick built in. Those can be very effective, helping them floss using, they're called proxy brushes. It's almost looks like a little bottle brush that you use to clean in between your teeth. Those can be very effective, and helping these folks keep their mouths as healthy as possible, because we know that helps keep their brains as healthy as possible. And the sooner we start that process, obviously the better outcomes we have.
Yep. And it's never too late to start, right? No matter where you are in your journey, maybe you're out there and maybe you haven't been to the dentist in years now, right? You got to start somewhere. So start there.
Yeah.
And build on that. And that's all we could do.
That is.
All right. Anything else to add, or I think we could leave it at that. Yeah.
Yeah, so definitely want to mention today the 5K that we have coming up. That will be January 10th. So spots are still available. The link to sign up will be in the show notes. You can visit it, runyourmouth.org. All the information for the race is there. This year's race will be benefiting the Davie Women's Club, which we're very excited about. And it is brought to you by the Chamber of Commerce and Semidey Dental. So we hope to see everyone out there. Again, it's January 10th. We can run, walk, or stroll. We also have the virtual race if you want to do it from your couch. But we do hope that everyone joins us. We hope to have a great race. There's going to be music. There's going to be IV tents. There's going to be food trucks and all sorts of swag, really cool t-shirts and medals and bags and things like that. So we hope to see everyone out there. And thank you, Mr. Wolf, for another great show. Again, folks, if you see some pink in the sink, go get checked out. It's never too late. And we hope to see everyone at the next show.
Yeah, and I just want to leave with this. You said you could, at the race, you could run, walk, or stroll. Brother, we are going to fly.
We're going to fly.
Oh, yeah. All right,
PR coming. Incoming PR.
All right, everyone, take care. Have a great day.
Keep smiling, folks.
Thanks for tuning in to this episode of the Semidey Dental Podcast. We hope you enjoyed the show. Don't forget to subscribe, leave a review, and follow us on social media for the latest episodes. You can find us at Semidey Dental. And if you have any questions, feel free to reach out. We're always happy to help. Until then, keep smiling and stay curious.